Great. Hi, everybody. My name is Mark Fisher. I am the Advocacy Engagement Manager here at MDA, and we're thrilled to have you at our final Advocacy Institute session of 2020. We're here. We've made it, and we just want to thank every one of you who is joining us today. We know that this has been a tough year for a lot of us, but we've done so many good things in this year as well, and we really wanted to take the time to highlight all the amazing things we've done, because we've done a lot, and we wanted to make sure everyone's aware of all the great work you've done and what that's meant. So we're excited to bring this to you and hope you enjoy the session. If you have any questions, feel free to plop it in the Q&A box at the bottom of your screen, and we'll definitely get to it at the end of the program. So with that, I want to do just a little bit of plug for the advocacy program. Many of you probably are involved with us and are on our list because you're on this webinar. But if you happen to not be involved, maybe someone sent this to you or you saw it on online or on social media, please join us today. We'd love to have you. You can join us in two ways. One, you can go to mda.org/advocacy, or you also can text us at MDA USA to 50457. And we can get you on our list that way. We would love to have you, especially as we go into 2021. The more voices we have together, the better. So what are we going to chat about today? I already gave it up. We're going to talk about what we've accomplished together. And we'll do that in 4 areas. One is access to care and therapies. We'll also talk about our successes in accelerating therapeutic development. Then we'll go into what we accomplished in empowerment and independence. And then finally, we'll talk about what we did around COVID-19. And, obviously, a year ago, I did not expect that bullet point to be on this slide, but we had to work on COVID-19 legislation. We had to make sure that Congress didn't forget about the voice of the neuromuscular disease community while crafting legislation. So we'll talk about that. We'll wrap up what's left to do in 2020. Congress does have a few more weeks left, so some things might be passed. We'll see, but we'll talk about that. And then finally, a sneak peek at what we're working on in 2021. Again, if you have any questions throughout the time, feel free to put it in the chat box. I want to introduce you to the panel. We are joined by me. I'm the bottom right square. I'm Mark Fisher, our Advocacy Engagement Manager. We're also joined by Kristen Stevenson. She is our Executive Vice President and Chief Advocacy and Care Services Officer. We also have Brittany Hernandez with us. She is our Senior Director of Policy and Advocacy. And then we're also joined by Paul Melmeyer, who is our Director of Regulatory Affairs. So that is your team today. Before we get into what we have accomplished, I wanted to chat a little bit about how we accomplished it. And it's because of the work of advocates like you were able to do this. And not only that, we were able to do it in a very trying year of 2020, where we had to change all of our plans to being 100% virtual. When we formulated our plans in 2020 early on, we had in-person plans. We were going to have folks meet with their members of Congress in the district and also in DC. And other things that we had planned, but COVID-19 turned it all on its head. And we had to pivot, and you came along with the ride right with us. You pivoted just as quickly, and because of that, we've made some great accomplishments. And we've done many amazing online campaigns this year, including a few on newborn screening, which Brittany will chat about that topic. But we also, again, had to do COVID-19 legislation. This is a topic that none of us obviously had any experience in advocating on pandemic-related legislation, but you came along with us and you advocated and raised your voice on something new, which was wonderful. We did some campaigns on surprise medical billing. We did a few on ALS therapies. And then we also did a new Share Your Story campaign, which we haven't done in quite some time, where you told us how you were doing during COVID-19 and you shared your stories with us. And that was really powerful. They're really powerful to read, and they're very valuable. We use those to shape how we talk to Capitol Hill with some of our meetings we had. We use them for some of our social media, but also your stories shape some of the things we did outside of advocacy. A few of the stories we heard were turned into blogs in our Strongly blog, and some of them were even used by some of our other areas at MDA. So thank you for sharing those stories with us. They were so valuable for advocacy, but also all parts of MDA. So that was a great campaign you helped us with. We launched this Advocacy Institute series. You can see the topics on the screen. We have had 6 total. This is number 6. We talked about advocacy basics. We had a discussion with the Food and Drug Administration, and we chatted with them about how they pivoted during COVID-19 with some of their clinical trial work. We celebrated the 30th anniversary of the ADA. We did one on voting rights with Senator Bob Casey, and then we had one on employment rights. And what was awesome is you gave us feedback on it. So we solicited questions from you, and we took those questions and it really shaped those webinars. So thank you for that, and we'll continue to do that in 2021. And then my favorite was our virtual Hill Day we did in August. Normally we would have a Hill Day where we bring people to DC, or we'd have them go to their offices and do those in-person meetings. Obviously we couldn't do that, but we had a handful of advocates who had virtual meetings with their lawmakers. And not only that, hundreds of you signed up to join them on that specific day, to send emails, to do phone calls, and to do social media advocacy that day. So that was a really fun event. It was very powerful, and we thank you for participating in that. So before we get into the victories, I just wanted to share that these victories are because of you, and you're able to just be as flexible as we were with COVID-19, and we're able to even raise your voice in a more powerful way. So with that, I'm going to turn it over to Kristen, who's going to get us kicked off about some of our work we did this year. Kristen?
Great. Thank you so much, Mark. And thank you everyone for being here with us today. And for those of you who are watching the recording, thank you for taking the time to do so. As Mark very well set out, this was an unexpected year from beginning to end. And I know it has been for all of you as well, and for all of the things that you're doing in your lives. And I think one of the things that we can all be very collectively proud of is that while we had to do all of the pivoting that we're going to be talking about today and that Mark teed up for us, we also stayed laser focused on having real priorities that will advance the neuromuscular disease community, and not letting up on any of those important priorities just because COVID arose and made it either more challenging or made it look different or added to the workload in terms of, for example, pursuing pandemic legislation. And so just to kind of remind everyone what the 3 policy priorities are across the organization, it's access to care and therapies from day one, accelerating therapeutic development, and empowerment and independence. And I'm going to hand it over to Brittany and Paul to dig into each of those categories a little bit deeper for the year in review. And Brittany, you can take it from here.
Thanks, Kristen and Mark, and everyone who is on this call with us today. I am really pleased to see a lot of advocates that I know already, and some folks that I haven't met yet. So this is really lovely. So under access to care and therapies, so as Kristen said, we at MDA split our policy priorities into 3 pillars. The first being access to care and therapies from day one, and this pillar encompasses everything around early detection and intervention, access to healthcare, ensuring that insurance covers what needs to be covered, ensuring that insurance is affordable and accessible. Really everything from, making sure that patients can get diagnosed as early and quickly as possible, and then they can get the treatment that they need in a setting that makes sense for them. So we have done obviously a lot of work this year over access to care and therapies in the midst of a pandemic. We've seen a lot of successes in the newborn screening space. If you look at this map on the slide, this is a really good representation of where we've seen movement in the states when it comes to newborn screening for neuromuscular conditions. So there's a national list of conditions for which the federal government recommends that all babies be screened. There are 35 conditions on that list. 2 of those conditions are neuromuscular conditions, Pompe disease and spinal muscular atrophy. When the federal government makes those recommendations to states, it is totally up to the state to decide when and if they want to implement that screening. And so we've worked to work with states and governors to try and convince them to add Pompe and SMA to their state's newborn screening panel. And we have been so lucky to work with a lot of other organizations across the space to see a lot of success here. And this map is very representative of that work that we've done with our partners. We are also in the midst of a newborn screening pilot in North Carolina for Duchenne muscular dystrophy. We're funding a project by RTI International in coordination with University of North Carolina, Chapel Hill, and Duke, their hospital systems, to screen babies for Duchenne through the Early Check program. And we're hopeful that the data that comes out of that program will be utilized to make a really great argument to that to the Secretary's Advisory Committee that makes the recommendations about what conditions states should screen for, and in favor of adding Duchenne to that national list. And so we are really pleased to be funding that in partnership with RTI. We also worked with a lot of our partners on the federal level to convince Secretary Azar at HHS to reinstitute that committee. The committee at HHS, the Secretary's Advisory Committee that makes those recommendations. And so the National Newborn Screening Program right now is not authorized. Its authorization has lapsed in Congress. We would love to see it reauthorized soon, and we are working on that. But in the meantime, before the authorization is done, since we don't want newborn screening work to wait, we're able to work to encourage the Secretary to reauthorize that committee to meet and continue doing its important work even outside of congressional authorization. And that was a great success and something that we're very proud of. And in the same vein, around reauthorization of the National Newborn Screening Program, we've also been able to work with our partners in Congress to ensure that federal newborn screening research is protected throughout the reauthorization of the program. And so there have been some efforts in Congress that would have certainly slowed newborn screening research on the federal level, and we've been able to stave those off for the time being, and we certainly consider that a success with our partners. Outside of newborn screening, we've done a lot of other work on access to care and therapies from day one. We have worked across the patient space, not just the neuromuscular space, to protect health coverage guaranteed by, through current law on behalf of patients. So protecting those provisions like essential health benefits, no discrimination based on pre-existing conditions such as a neuromuscular disease, and on and on and on, and have been very pleased to see all of those protections upheld by Congress. And then we also recently, just as of last week, submitted a nomination to the federal government to have LGMD get an ICD-10 code. And an ICD-10 code is a code that enables doctors and their offices to better track patients who have been diagnosed with a certain condition. And so once this code is in the system and it's been accepted, if it is accepted, and we are very hopeful that it will be, then we'll be able to get a better idea of tracking patients with LGMD and their diagnoses and their path with the condition. And so we're really excited about that. Go to the next slide. I will turn it over to Paul to talk about this slide.
All right, well, thank you very much, Brittany, and good afternoon, everybody. This is Paul Mellmeyer, Director of Regulatory Affairs here at MDA. And similar to all of the achievements that Brittany mentioned in our first pillar of advocacy, there's a lot to talk about within our second pillar of advocacy on accelerating therapeutic development. Really our overarching goal within accelerating therapeutic development, there are two. The first is to, as would be indicated by the title, accelerate the development of more and better therapies for those in the neuromuscular disease patient community. But the second is to really integrate the neuromuscular disease patient voice in absolutely everything that not only the Food and Drug Administration does, but also the biopharmaceutical industry does as they are developing new treatments for the neuromuscular disease patient population, and as FDA is then reviewing those treatments. So really the first bullet here is in service of the latter goal I just mentioned, and that was our patient-focused drug development meeting for those in the Pompeii community that happened in July. Now this was a meeting that was originally supposed to be at the beginning of March, and this was just as the pandemic was starting, and we made the difficult choice of postponing till July. Of course, the right choice to not hold that meeting in person. And thankfully the meeting went splendidly. We really were able to learn a lot about the experience of an individual living with Pompe disease, and we were able to educate the FDA and the biopharmaceutical industry participants in the meeting on the daily experiences of living with Pompe, as well as preferences for current and future treatments for the Pompe community. We were also pleased to support a second patient-focused drug development meeting, and that was of the FSHD community. We were very pleased to support the FSH Society's efforts in holding that meeting, and there were similar beneficial outcomes of that meeting as there were for the Pompe disease community. We also were very involved in introducing a new piece of legislation called the Act for ALS. Now, on its face, it may seem that it's specific for ALS, and actually there is one provision within the bill that is indeed specific to ALS, and that is a new grant program that would facilitate expanded access programs within new ALS treatments. But there are also 3 provisions within the Act for ALS that would actually benefit the entire neuromuscular disease community. The first is the bill would create a new HHS collaborative on neurodegenerative diseases. And what this means is agencies across the Department of Health and Human Services, such as the FDA, but also the NIH and the Centers for Disease Control and Prevention and others, would come together with private entities such as organizations such as MDA, as well as biopharmaceutical companies, researchers, everybody within the stakeholder community. They would all come together under this collaborative to try to accelerate research into neurodegenerative diseases. This bill would also create an FDA action plan in which FDA would put forward exactly what is needed, both from FDA but also from outside groups, to accelerate treatment development further with the neurodegenerative diseases. And then finally, a new grant program would be created at FDA to actually fund new research into neurodegenerative diseases. So as you can hear, this bill really does a lot for the neurodegenerative and the neuromuscular disease patient population specifically, and we're very grateful to be able to help craft this bill with partners in the advocacy community and also partners on Capitol Hill. An issue that is actually very topical to this very week is the reauthorization of the Rare Pediatric Disease Priority Review Voucher Program. Just a little while ago, it received a short-term reauthorization. It was supposed to expire, actually, at the end of September. Thankfully, Congress pushed that deadline till Friday. So we are hopeful that they will push that deadline once further, if at the very least a little while longer, so the program can continue. But actually, the House of Representatives did pass a 4-year reauthorization of this program just about a couple months ago. So we're hopeful that by the end of the year, not only will this program have been reauthorized in the short term, but actually will have been reauthorized for several years to come, if not longer. You know, everybody has adapted to the COVID-19 pandemic, and one of those adaptations that we worked with the Food and Drug Administration on was pertaining to clinical trials, especially clinical trials for those in the neuromuscular disease patient population. We wanted to ensure that as everybody was staying in their homes and they weren't traveling to clinics, they weren't traveling to hospitals, and clinical trials were having trouble enrolling new patients or having trouble maintaining the ongoing trials that had started before the pandemic had started, that these trials would not fail. As we all know, any trial failing in the neuromuscular disease field is horrible, because there are so few trials to begin with, and there are so few approved treatments to begin with. So we at MDA wanted to make sure that we did everything we could to ensure that those trials wouldn't fail. So we worked with FDA, not only to hold an advocacy institute just like today's on this very issue back in June, as was already mentioned, but also to work with them on issuing guidance to clinical trial sponsors on how best to maintain their clinical trials as the pandemic continued. We filed comments with the FDA, and we were very grateful that FDA updated their guidance to reflect some of the comments that we had submitted, some of the requests that we had asked of the agency. And they've actually continued to update that guidance ever since. And thankfully, most clinical trials within the neuromuscular disease space, if they had paused due to COVID, have now unpaused. They are continuing again. And thankfully, some trials are even concluding and meeting endpoints. And it's very exciting that this is all happening as the pandemic continues. Finally, one final thing to mention before turning it back to Brittany to talk about our final pillar is a patient-centered FDA reform proposals to be included within the prescription drug user fee reauthorizations. Now, that was a whole mouthful right there. what you need to remember is that right now we have the opportunity to reform FDA practices really across the board, because a good portion of their funding is coming up for reauthorization in Congress. And every time we have this opportunity, we, being the patient community, but also the biopharmaceutical industry and other stakeholders, have the opportunity to take a very close look at what FDA is doing and then offer reforms for Congress to then enact to better what FDA will do in the ensuing 5 years from there. So what we did at MDA back in August, we actually published our proposals for this reform opportunity. And it really is quite the comprehensive set of proposals. It covers gene therapies, it covers decentralized trials, meaning trials that can happen from home. It covers patient involvement at the FDA, and much, much more. So 2020 was really quite the year for accelerating therapeutic development in neuromuscular diseases. That doesn't even come to mention the treatments that were actually approved in neuromuscular diseases, which also should be celebrated. But a lot to go into further in 2021. But before we get there, Brittany, I'll hand it back off to you.
Thank you, Paul. Lots of exciting stuff there. So really, really appreciate you going through that for everyone. Our third pillar we call empowerment and independence, and this really encompasses everything around helping and enabling individuals with disabilities to take advantage of their civil rights and many options throughout the employment space, accessibility, and education and things of that nature. And so we have been very engaged over this last year on air travel issues, as we have been, for a number of years here now. Many of you may have seen that American Airlines in the last few months issued a weight policy that would essentially eliminate air travel for many individuals with electronic wheelchairs. And so we, in alignment with a number of our partners in the disability advocacy travel space, were able to advocate to American to request that they revisit this policy, and they did reverse it in pretty short order. And so we're very proud to see that happen on behalf of individuals who travel with a wheelchair. We also saw a number of co-sponsors sign on to the Air Carrier Access Amendment Act, and this bill would create many more protections and guarantee many more rights to individuals with disabilities who travel by air. And we were really pleased to utilize our advocacy, all of our advocates across the country to advocate to their members of Congress in favor of co-sponsoring this legislation, and just were very, very pleased to see so many members sign on to that bill and support. So while it won't pass this year in these last few weeks that we have left, we do know that we will be going into the new session, the new Congress next year, with a good foundation of members that we can get back on pretty quickly as co-sponsors and keep moving forward that way, so that hopefully we can get committee consideration done in pretty soon next year. We also Kristen serves on the ACAA Advisory Committee at the Department of Transportation, and this is a committee made up of a number of advocacy organizations, airlines, and manufacturers of both aircraft and assistive devices that advises the DOT on the needs of individuals when they're traveling. And so obviously, or advises DOT on the needs of the entire industry. And so we obviously represent traveling individuals, and Kristen is very active on that committee, especially when it comes to the stowage of devices. So ensuring that wheelchairs, when they are loaded and underneath the plane, under the cabin, that they are done so in a manner that does not cause damage or destruction to them. And we're very pleased with our involvement on that. Kristen, is there anything else that you'd like to add to that?
Yeah, thank you, Brittany. I think this is an area for us to really watch and continue to stay engaged in over the next couple of years. There really does seem to be some movement happening in terms of what the opportunity is to work collaboratively kind of across industry and regulatory agencies and with the community. And so I think that this this group that does the advising, which was born out of legislation that we very strongly supported in conjunction with our other advocacy groups that we work on this issue with, is a great opportunity for us to be involved in that way, and probably sets out a framework for us to think about how we can get involved in these kind of collaborative engagements in other areas as well.
Great, thanks, Kristen. And the last thing that I would like to point out on here is a great victory that just happened this week. That as of yesterday, both the House and the Senate have voted in favor of passage for the ALS Social Security Disability Insurance Act. And so this bill is specific to individuals living with ALS, and it would eliminate the 5-month waiting period for individuals diagnosed with ALS to access Social Security disability benefits. And while it is limited only to the ALS community, we are supportive of it, one, because we represent the ALS community, but two, because it's a good framework for moving forward, for doing the same for other conditions, for individuals living with other conditions. And now that Congress has passed this, we know that there is certainly opportunity to do so on a broader scale for people living with other neuromuscular conditions. And so we are waiting for the president to sign it, but it does have a veto-proof majority in both the House and the Senate. So it will become law, and we are very excited about that. So this year we pivoted when the pandemic struck in March, and as we laid out earlier, kind of our priorities for the year, we needed to not change our priorities, but ensure that we were executing them in a way that reflected the current situation. And so right here on this slide, what we've done is kind of called out the areas in each pillar where we expanded upon our original priorities that we had set forth in January of this year. So under our first pillar of access to care and therapies from day one, we have worked to promote policies that ensure availability of testing, treatment to the neuromuscular community without discrimination. That includes also accessibility of the vaccines once they're on market. Under accelerating therapeutic development, we have advocated for continued development of neuromuscular therapies throughout the pandemic. We have worked with the FDA to ensure that clinical trials can be modified in order to reflect the current situation of people needing to social distance and stay at home, and including televisits for clinical trials. And under the empowerment and independence pillar, we've worked to promote policies that enable everyone to access necessary funds and services throughout the pandemic to ensure that people can continue to stay employed or find employment, that they can stay, in their homes, and just those general, the general protections that we have in place for the community at large. Sorry, I have an interlude with my toddler. So what we've seen throughout the pandemic is a lot of work that we've done, like I just mentioned. Specifically, though, we supported passage of Families First Coronavirus Response Act, passage of the CARES Act, which was Ellie, please, passage of the CARES Act. Can I ask Kristen, can you do the slide?
Yep, I was just about to offer to jump in. Happy to. We've been very focused on multiple different avenues and angles, if you will, around COVID-19. And that includes everything you see here on the slide, as well as really being coordinated across the organization in terms of developing material and information, being able to get it out early and often, particularly at the beginning of the pandemic. We worked closely with our medical advisors to get guidance documents out on clinical management in the time of COVID. We're also working diligently on vaccine guidance information in conjunction with clinical leaders across the neuromuscular disease space. And all of that really ties together and is being led by the advocacy activities to make sure that at the end of the day, we want to make sure that everyone in the neuromuscular disease community has access as early as possible to any and all vaccines that are approved and are available in their area, and at no cost. And so, Brittany, I'm happy to turn it back over to you if you would like, or I can keep going.
Sure. Thank you. Why don't you, did you speak yet to the Office of Civil Rights issue?
I did not go into any of the detail. I did more of kind of the high level overview of how it all ties together.
Sorry about that.
No
Pandemic
worries.
times, you guys, with a toddler at home. So,
Everyone's in it.
one thing that we worked on diligently with a number of our partners across the patient space and the disability space is publication of guidance by the Office of Civil Rights at HHS to ensure that individuals with neuromuscular conditions and other pre-existing conditions would not experience care rationing if they were to contract COVID-19. And so many states and hospital systems have these kind of these plans that they haven't really ever had to put in place recently, but to deal with a pandemic just like this. And so how are they going to, and these plans help them decide how they are going to deliver care to a population throughout, this kind of like crisis mode that they were all in. And many of these plans were not ADA compliant plans. They were a violation of civil rights law. And so we advocated to the Office of Civil Rights to kind of come out and say, listen, this can't happen. You cannot discriminate based on somebody's health condition on whether or not they deserve care through a pandemic. And so we were very pleased to see that come out. And in the wake of that, have seen very few complaints about any kind of care rationing. And so, and there's definitely more attention being paid to it now because of that guidance. And so that was certainly a success for the neuromuscular community and the larger patient community as well. We have worked with FDA to issue transparent guidance on adjusting trials due to COVID-19, like I said on the last slide. We've also worked to ensure that telehealth policy is not just reflective of what's happening right now, but that many of these changes can be carried through after the public health emergency ends. And so we are working both on our own at MDA and across the larger patient community because we know that patients and doctors like these telehealth changes that we've seen, many of them, and want to keep them in place and maybe want to see some more implemented as well. And so we want to keep working with patients and providers to make sure that once the public health emergency ends, that people can continue to see their doctors virtually if that's what they want to do and is appropriate for them. I'm actually going to turn it to Paul for this last bullet about early vaccine access.
Yeah, thank you, Brittany. So as everyone I'm sure is closely tracking, perhaps daily for that matter, because there are daily updates on this topic, COVID vaccines are on their way. We know that right now there are 2 vaccines in front of the Food and Drug Administration, those from Pfizer as well as from Moderna. There are also a handful of vaccines just a bit further back in the pipeline, a few in phase 3 clinical trials and a few more in phase 2. So right now, the Centers for Disease Control and Prevention, they have been deliberating on their recommendations on who should get the vaccine and when. And they have a special committee called the Advisory Committee on Immunization Practices that have been deliberating on this very topic. We at MDA, we actually wrote to that committee in October asking for those with neuromuscular diseases to be included in the very first phase of allocation. And the reason for this is because we understand that oftentimes an individual with a neuromuscular disease may be at risk for a severe high-risk COVID-19 experience due to some of the symptoms and comorbidities that neuromuscular diseases can create. And so because of this, we wanted to be sure that our community was going to be right up there at the front of the line with all other individuals with high-risk medical conditions in receiving a vaccine. Now, it's actually not up to the CDC. It's not up to this advisory committee. It's not up to the CDC on who gets it and when. It's only the CDC's job to advise jurisdictions on their allocation plans. And there are 64 jurisdictions across the US who are making these decisions really as we speak on who gets these vaccines and when. So these jurisdictions are going to decide on when the neuromuscular disease patient community will be able to get the vaccine. And you'll actually be hearing from us rather shortly on our encouragement to these jurisdictions to include those with neuromuscular diseases really as soon as possible within their vaccination allocation plan, so we can be sure our community gets the vaccine as soon as is reasonable. So we've been very pleased to be advocating on this topic, and you'll see more from us on this topic as vaccines become more available. Back to you, Brittany.
Thanks, Paul. And so, we have gone through a number of things that we've done throughout this last year, and that we're really proud of. There's a lot left to do, though. Both, in the intervening weeks between now and 2021, and when we get to 2021, and have gotten a little bit of a snapshot into what we've done. So here's what we have next. So there's supposed to be another COVID-19 stimulus package happening between now and January 1st. Will it happen? Won't it happen? I'm not going to guess. We're watching for it, and we're trying to ensure that our community is well reflected in whatever comes out between now and next year. For next year, we'll continue to work on COVID-19 legislation and vaccine access, as Paul just mentioned. We launched the MDA collaboration grants about a month ago, and we'll be executing on those in the first quarter of next year, soliciting applications. And there's more information on this on the advocacy site if you are interested. And we invite you to check it out and think about if you know of organizations or partners who would be well suited for that program. We'll be working a lot more on access to care and telehealth. As I stated earlier, there are a lot of plans across many of our partners in the patient community to work in a coalition basis on this on behalf of all patients, to make sure that people can continue to receive the care that they need in the setting that makes the most sense for them. We'll also be working on legislation interventions for prescription drug access, like Paul mentioned earlier. It's critically important for our community now, especially as we're seeing so many new drugs and treatments in the pipeline, and we'll be really, really engaged and involved there. We'll continue to try and work with FDA to improve clinical trials for the neuromuscular community, and just ensure that the FDA in general is moving at the same speed that the rest of all of us are towards modernization of their processes and procedures and the work that they do. And then I'm also really excited to share that MDA is going to be getting more involved in policy and advocacy around access to higher education and job training. This is something that we've heard from our community that they want us to get more engaged on, and I'm excited about the possibilities of us working with some really exciting partners on this. There will be more information to come on it, but there we'll definitely have some exciting opportunities for our community to get involved in advocacy on access to higher ed and job training. That's just a few of the things that we'll be working on. All of the issues that we mentioned in our 3 pillars will continue to drive us and dictate where we allocate our prioritization and our time and resources. But we invite you, all of you, to reach out to us and let us know what it is that you would like us to be working on, or if there are certain policy issues that that you have a particular interest or engagement in. If there is a member of Congress that you know really well and want to tell us about that, so that we can work with you to get in the office with them and talk to them about our priorities. We are always an open door, and we hope you'll get in touch with us on anything and everything, and we'll continue to be in touch with you too.
Great. Thanks, Brittany. Thank you, everyone, for what we accomplished. It's kind of amazing when you get to see it all together, all the stuff we've done this year. It's been quite remarkable. We're about to go into a Q&A session, so before we get there, please, if you have any questions about what you'd heard about, what we're going to work on next year, please plop it into the Q&A box, and we'll get to those next, so don't be shy. And I just want to say one more plug for our advocacy program. If you're not already a member, please join today. A lot of things I even wrote down that we accomplished this year, a lot of it was because of the work you did. So when we're able to restart that newborn screening committee in the spring, it's because we delivered thousands of petitions to the HHS secretary, petitions of people of everyone on this call who signed. That was a direct result of that. A lot of the COVID-19 legislation, like the CARES Act, was one of the reasons it passed, because of grassroots support of our community help put it over the finish line. And then the ALS SSDI insurance bill that passed, we got letters for that as well. So your voice does make a difference. These successes can't happen without you. So please, if you're not a member, there's 2 ways to join. I said it before, they're on your screen now. You can go to mda.org/advocacy or text MDA USA to 50457. We would love to have you as we work to next year. So with that, I think we'll go to the Q&A as we speak. The first question, which is always, I should say this at the beginning, is yes, Nikki, this will be recorded. No worries on that. You can go to our advocacy website and you can see them all listed there. So it will be recorded. I expect it won't be up until around probably tomorrow or Friday, but we'll get that up for you. The next one, Paul, this might be a question from Kevin, if you want to take it on.
Yeah, Mark, thank you for the question. I'll read it and then I'll actually read it to Kristen as Kristen can answer. So the question is from Kevin and he asks, Pfizer and Moderna are using new technologies/methodologies for their vaccine, while AstraZeneca is using more traditional technology. Is this a concern, especially given the delivery method? Kristen?
Great, thank you so much for the question. And it was not a plant, but it couldn't have been a better first question to start this part of the session. We are literally in real time today and tomorrow working with the MDA Medical Advisory Board, as well as some additional clinicians across the country who are clinician leaders in the space, and taking to them the questions that we're receiving and putting together an FAQ. And we know that there are a lot of unknowns right now, but what we will do is continue to update that FAQ as we learn more and as we as a community have more information as vaccines are approved, as distribution channels and prioritization categories are confirmed. So we will be getting a first pass at an FAQ based on what we know now out as soon as possible. I think you can look for that early next week with certainty, and we will continue to update after that. And we will make sure that we include this question that you've shared in the content that we are getting our medical advisors to give us guidance on. So thank you for that.
Great. Our next question is from Jessica. She wants to know, when you reach out to your local leaders or your congressional leaders and you get those responses back, would we like them as an advocacy team? Please send them to us. It's really helpful. It can be at send it to me or advocacy@mdausa.org, or you can send it to me personally, mfisher@mdausa.org. Please send them along. It's always interesting to see how they respond, and sometimes us as a team can get some clues from them. So please send them along, and it's just nice to know that they responded to you. It's really helpful for us. So first, thanks for taking action, and then yes, please send them along. The next one's from Nathan, and I'll take to the group, and maybe we can answer this together. But what is the decision criteria for choosing diseases for a PFDD meeting? So I can't answer that one, so I'll leave it up to the group.
Mark, I can take that question and then ask if Kristen and Brittany have anything to add from there. Nathan, thank you for the question. It's a very good one. It sounds like a simple question, but it's actually a rather complicated answer. And it boils down to, it depends. It boils down to where therapeutic development is in the disease in question. Are there clinical trials ongoing that a patient-focused drug development meeting could help instruct in the construct of that clinical trial? Is FDA approaching a potential regulatory decision on a new therapy in which a patient-focused drug development meeting could be helpful to educate the FDA on the new therapy and the patient population that will eventually take that new therapy, hopefully, to educate FDA on what it's like to live with that specific disease. So for Pompe disease, I can tell you there were clinical trials ongoing. There still are, of course. And FDA is very possibly going to be approaching regulatory decisions in the next year or two on therapies for Pompe disease. So that helped us make the decision that it was the right time to be holding a patient-focused drug development meeting for Pompe disease. So Nathan, I would say MDA is always open to either partnering or supporting or anything of that nature for patient-focused drug development meetings within the neuromuscular disease patient population. Reach out to us to have that conversation of do we all think that it's the right time to have that PFDD meeting, and if so, what role can MDA play? I'll pause there. Kristen and Brittany, would you add anything to that?
Yeah, I'll say all of that is, totally on point. I'll also say that there are other opportunities to engage with the FDA on the PFDD program that aren't just these huge giant meetings. We can engage them and on a smaller scale, or via publication of joint like white papers and things like that from the patient perspective. And I think that we should think creatively about this moving forward with our community, and ways that we can work with them, especially considering the ongoing situation with the move to virtual, that perhaps the large meetings requiring so many people to travel aren't going to be as effective moving forward, as people are more hesitant to travel. And so I would encourage everyone here and your colleagues to keep us in the loop if there are opportunities that you can identify that we might be able to do PFDD efforts on together, and to think creatively about what those might look like.
Yeah, that's a great point. I think that's another example of how we might find that some of the COVID pivoting activities really end up building even greater opportunity, particularly for our community, given the very real challenges around travel and mobility. So thank you for that.
Great. We don't have any more questions in the queue, but I'll give it just another moment to see if anyone has any last questions they want to ask us. I'll give it just one more minute and see if anything comes up. All right, I'm not seeing anything. So first, I just want to thank all of you for joining us today. And joining us for all the other ones as well. I know many of you, I can tell, have joined every single one. So for that, thank you very, very much. I just want to wish everyone a happy and healthy holiday coming up. Please enjoy the celebrating as safely as you can. I think everyone deserves some relaxation and some celebration. So we really just wanted to bring this to you and really highlight all the amazing things we've done together. So thank you all very much, and we will see you all in the new year. Thank you.